welcome everybody. So just a few ground rules today. First rule is there are no rules. The whole objective is to try and get an interactive dialogue going, and so high energy, feel free to interrupt any speaker at any point, ask questions. We don't want this to be kind of a push death by PowerPoint day, so we want to really encourage high levels of interaction. And about the only timed interrupt we will have is the Vice Chancellor of Cambridge University, Sir Leszek Borisovich, otherwise known as Boris, will come in here at exactly what time? Approximately. About half, so he'll come in and say a few words. So at that point we'll stop whatever we're doing and he'll come and say a few words, because this subject is very close to his heart, and you'll know that his background was he was head of the Medical Research Council in the UK, head of Imperial College at one time. So, and he's a medic, so he comes from a very strong, very medical science background, and this is a subject close to his heart, so he's very actively involved in helping to drive dialogues from the Cambridge end. Okay, and so I'll just drive this from here. Yeah, thanks, Aaron. So, so you'll see the whole idea. This is a very, very vast topic, as all of you know. You know, innovation, digital in healthcare. It's a massive space. And when we were putting this event together, we felt that we should embrace the fact that it's a very diffuse subject and try and identify a few strands to provoke dialogue around. And so the objective here is unashamedly to try and encourage commercial development of ideas. Okay, so that's what we're trying to do. And so Accelerate India, you know, the group of us, we started this company 5 years ago, started actually in Cambridge. Started a journey, and the whole idea behind what we do is to try and connect UK based technology companies with equivalents in the Indian scene. And so we've seen a number of collaborations, and over lunch I can tell you about some of the things we've been doing in terms of trying to create new commercial value for both sides in this dialogue. So why RiffStream? You know, this is really something that came about when we started running events. We brought people into closed rooms and trying to create discussions, and we realized that what we were trying to do was quite innovative in terms of being not very well defined at the start of a journey. And so this idea, and some of us who are musicians thought that actually every theme, every idea was like a musical riff. You get your guitar out and you strum for a bit and you have a riff. And in a sense we have lots of riffs in this room because people have got thematic ideas, they're doing stuff, and what we hope is, like, combining some of these riffs, we can create a massive stream, maybe even a river one day. And so the idea is, at the end of this process, we think some of these riffs will combine, and if we can generate 2 or 3 major riff streams of activity, of collaboration, then we will have actually achieved success. So today is really an environment, and you know, if you look at that, what it says on there, you know, an audition. I mean, you think about when jazz musicians get together to jam in a session, there's a lot of hit and miss, and that's exactly the cut and thrust. Life isn't very well defined, so there'll be quite a lot of hit and miss in the dialogues, and you'll suddenly find people you didn't expect to find, ideas you didn't think were going to come to you. So that's the objective. So again, you know, what we're trying to do in terms of objectives is summarized on that. Now, the other thing worth saying is that, you know, you'll notice we have video cameras here and we're recording everything. So all this content will be sliced and diced and put up online, because we don't see this as an event in itself. This is the start of a journey, and we want to make sure this journey is curated and the dialogue continues. So if there's anything really commercially sensitive that you don't want recorded and put on the web, then I suggest you don't say it in plenary. Or if you do say it, let us know so we can edit it out subsequently. Okay, so we're really talking about the healthcare ecosystem, and so this is, if you like, our broad working definition of the things that are of interest to us. So one is really diagnosis. So it's all the tools around diagnostics and trying to find things out early and later on. That's one area. The second is around the use of targeted drugs. The third is the development of new treatments. A number of people here have got interesting ideas with new devices, new treatments. And then there's the whole area around faster delivery, accurate delivery of drugs. And then the whole area around digital technologies, what people like to call M-Health. So it's a vast field, and people have very different perspectives, very different commercial interests in terms of what they're trying to do. So this isn't an apology, if you like, for how fractured the day could get, but this is an attempt to try and bring a little bit of order to the day. And so we're really trying to divide the stuff into a number of main constituencies. So we want to look at the whole area of infrastructure, products, services. That's one area. So this whole area of people who are developing tools, technologies to deliver in. And then, of course, we have the people who, if you like, consuming or using the technology. And so patients, clinicians, and a proto-patient. I think one of my colleagues invented the word. A proto-patient is somebody who is liable to become a patient, which, you know, for those of us who are getting older, you know that you're definitely a proto-patient at some point in your life. And then the third area is the important one, which we mustn't forget, is how does money get in? Because ultimately all these things, you have to think about where the money is going to flow. So, you know, we want to talk about government funding, look at money from the private sector, the insurance sector, and we hope to get some insights through the day on that. And we're going to have one speaker who's going to try and provide some personal perspectives on the regulatory environment around medical devices in the Indian marketplace. Has he arrived? Yeah. Oh, hi. So we've got a number of different perspectives we're going to do. And so we've done this bit. And so what I thought, Richard, do you think we should launch into Riff 1 straight away? So the first riff, so we've organized our speakers into along these 5 riffs that we're going to cover. And the first riff is around innovation in delivery systems. And so we have a number of speakers who got some slides lined up who are going to come and talk. And my desire is that people present for about 7-10 minutes so we have a really vigorous, intense discussion. But anybody feels they need to present for 25-30 minutes, we'll just deal with that. We'll just interrupt the speaker and ask a lot of questions. Okay? So, high energy. And I think probably start off with Shantanu. I think you're first on. Is that okay? You all teamed up? Welcome. And so it'd be useful when you start off, just say a little bit about yourself and where you're based, what you're trying to do, so that people get a sense of the originating point.